Thank you all for joining us. Thanks for coming. I know it was short notice when we announced this yesterday, but we are taking this team through a couple of cities here in the United States, and we thought it would be an ideal opportunity to give you an opportunity to ask them some questions. So at the panel with me are three of the UN's leaders on the Ebola response, how we are working together to try to contain the Ebola outbreak that's going on in some countries in West Africa right now. Immediately to my left is Dr. Margaret Chan. She is the Director General of the World Health Organization in Geneva, Switzerland, and she is leading the response of the organization on Ebola. And to her left is Dr. David Nabarro. Now, David Nabarro was appointed by the Secretary General of the UN to be the coordinator across the UN on the response to Ebola. And at the end is Dr. Keiji Fukuda. He is the Assistant Director General for Global Health Security at the World Health Organization in Geneva, and he is leading the technical aspects of this response for WHO. I'm Christy Feig. I'm the Director of Communications in Geneva, and we're going to start by letting each of them make a few comments. All three of them have been in the region. David and Keiji have been there last week. The Director General was there a couple weeks ago, and they can reflect on their particular areas of work and what they've seen in the field to talk about what needs to be done and what we are doing to get this controlled. So I'll start with Dr. Chan.
Thank you, Christy. Good morning to all of you, and thank you for coming. Perhaps let me give an overview of the epidemic, and then I would invite my colleagues David as well as Keiji to share their views on this. This Ebola epidemic is the largest and most severe and most complex we've ever seen in the nearly 40-year history of this disease. No one, even outbreak responders, would experience, dating back to 1976 to 1995, people that were directly involved with those outbreaks, none of them have ever seen anything like it. And this is our discussion, with these experts. Now, as of this week, we are reporting 3,500 cases confirmed and probable cases in Guinea, Sierra Leone, and Liberia. More than 1,900 deaths, and the outbreaks are rising ahead of the control efforts in these countries. I'd like to also touch upon the situation in Nigeria. The outbreak in Lagos is much smaller, and most cases are linked to an air traveler from Liberia, and of course, one of those contacts evaded monitoring and went to Port Harcourt, the river state. And there we are watching very closely the response of the government to do contact tracing and to take care of the sick. And of course, we want to thank the Nigerian government for their efforts, but also many partners, CDC from USA, MSF, and other colleagues, including WHO, are working very closely with the government. Now then, let me turn to Senegal. Senegal reported its first case on the 29th of August. Again, this is an imported case from Guinea. A young person traveled, drove to Senegal, and the government is still reporting only one case, but of course, they are mounting a strong response to do contact tracing and monitor all those people that have been in contact with this young person. Democratic Republic of Congo, this outbreak is smaller, and at this point in time, we have epidemiological evidence as well as viruses sequencing to demonstrate clearly that this is an independent outbreak. It is important to highlight this point. It is not a spread from West Africa to Central Africa. So that means we are seeing a much, much bigger outbreak, or people coin the term epidemic, in West Africa, while at the same time, DRC is reporting a smaller outbreak on its own. It is important for me to highlight one point very clearly. We should not stigmatize Africans and the continent and call this an African disease. This is uncalled for. And this stigmatization is already playing out in a big way at the country level and beyond, and causing the coordinated global response much more difficult. And Ebola is not a new disease in the sense that, we know what to do, we know how to do it, but, we do need to coordinate global efforts to deal with this. It has become a global threat, and we require urgent action, and we need a well-coordinated mechanism bringing together the countries affected, as well as development partners from other countries, including USA. Now that I'm in US, I want to tell you, the US government has been a very strong supporter through many agencies like the CDC, NIH, and of course, USAID and others. Now, the scientific community will be convened to come together on Thursday and Friday this week in Geneva to look at what are the most promising experimental therapies or vaccines that, the international community and through the scientists advised that we could fast track and bring some additional interventions to help with this outbreak. Let me finish on one point. In order to guide the coordinated response, the international surge response, the World Health Organization has launched the Ebola response roadmap on 28th of August. This is a roadmap informed by the experience of the affected countries, also the many partners like the African Union, European Union, MSF, Red Cross, Red Crescent, and of course, Mr. Secretary General and Deputy Secretary General themselves, the World Bank, the African Development Bank, and some countries that are already supporting the efforts. I would like to mention a few, and in appreciation of their support, but at the same time encourage them to do more, and also encourage them to bring on board other countries that have yet to do so. US, UK, France, Canada, DRC, Uganda, and South Africa. These are providing experienced experts who used to manage previous outbreaks to help these countries. And of course, China, Kuwait, Swiss government, and the list is quite long. As I said, this is an international issue, a global threat, and that requires global coordination to get it done. And as I said, we can and we will bring the Ebola epidemic under control. Thank you.
Thank you, Dr. Chen. Dr. Nabarro?
I'm going to pass on to Dr. Fukuda to start, and then I will supplement.
Okay. Thank you, David. Thank you, DG. Everybody, let me just pick up a little bit where the Director General left off. Dr. Nabarro and myself did go to both Monrovia and Freetown last week. This was
Excuse
the
me,
most...
Dr. Nabarro?
Hello?
No, it's Dr. Fukuda. That's Dr. Fukuda.
Are you having a difficult time hearing?
Yes, ma'am.
Okay, this is Dr. Keiji Fukuda. He is the Assistant Director General for the World Health Organization. And Keiji, if you can just speak a little bit louder.
Sure. Can you hear me now? Hello? All right. I don't know. All right. Well, let me go on anyways. So just to pick up again where the Director General left off, last week Dr. Nabarro and myself did travel to Monrovia and Freetown. This was the most recent of a number of visits that we've made to the region. We were accompanied and went with some other WHO staff, some of whom remain there and continue working, joining other colleagues. And in the region, we had a number of different discussions with a very wide range of people. So these included meeting with both of the presidents of the country, meeting with several of the ministers involved with the response, as well as members of the various task force and emergency operating groups and so on, addressing the situation. We also met with senators and county level officials. We spoke with a large number of ambassadors and representatives of different organizations working there, both from critical partners as well as from the UN organizations. But probably the most important series of discussions were held with people who are closest to the ground. And so we attended a town hall meeting where traditional leaders and community leaders met. And then on the last day, I was able to meet with a group of about, 50 or 60 representatives from West Point, which is the area which has been one of the most heavily impacted places in Monrovia. And so it gives you a sense of the kinds of people that we're talking to get a better picture of what's going on. And also, as part of our visit, one of the things that we wanted to see was many of the places where people are actually being taken care of. So in Monrovia, we visited the John F. Kennedy Hospital, the Ebola treatment unit, which is near there, as well as Ebola treatment units being run both by the government and by MSF, Médecins Sans Frontières. And then in Freetown, we visited Connaught Hospital, which is also taking care of patients. Now, on the basis of this visit, we clearly heard about a lot of different issues and challenges going on. Probably, as you know, the most difficult one is simply we are seeing more cases appear, and the trend continues to go upward here. Now, in having discussions about this and trying to understand this better, probably the most important thing to understand is that many of the infections, really the bulk of infections, are taking place in the community. They're taking place in families, and they're taking place because people are taking care of each other out in the community. And the reason for that is that there's simply a lack of capacity in many different ways. There aren't enough beds for people to go to if they are ill. There are not enough ambulances to transport people when they're ill. And as a result, many people are staying at home to be taken care of, and many people are simply unwilling to be identified as having an illness because there are no real benefits to that for many of them. And I think that the reason why I want to emphasize this point is that finding places, taking care of people who are ill is absolutely central to how we're going to control this outbreak, because that's the way that we're going to know who is infected and how to take the steps to prevent infection from going from the people who are infected to others. Now, one of the big themes that we heard from everybody is simply the lack of capacity in many different ways. We know that there's a lack of vehicles. We know that there's a lack of trucks and ambulances to carry either bodies or people who are sick. We know that there are gaps sometimes in supplies such as gloves, personal protective equipment, and so on. There is a lack of funds coming into the country and coming into the different groups working to support. There is a lack of good practices. Infection control practices in many of the places are not up to snuff, and we see that because we still see healthcare workers getting infected. But of all of the things which are low in capacity, the single most important one is that we don't have enough people on the ground who are able to take care of the many things which have to be taken care of. So these include health workers, nurses and doctors, but these also include people who are transporting people. This includes people who are conducting contact tracing in the communities and so on. And this is the most difficult of all of the areas in which we have gaps in capacity. But the third point, and the last point that I want to make, is that when we met directly with people from the community, there are some other things which are clearly important to people living in these countries. The first one is that they want information. They want to understand what is going on, how are decisions made, why are they being made. They want to understand how to do things. In fact, many people understand that it is now unsafe to touch someone who has died from Ebola. They understand that if somebody is sick, that they can get infected from them. But what they don't understand, well, what do we do? What do we do in those instances? What can you tell us what is safe to do? They want to know that they are recognized in being in a special circumstance. When you talk with people from West Point, what they have said is we want people to understand that we feel stigmatized, that we feel isolated, that we are under extreme stress here. They want their voices to be heard. They want to know that other people know what they are going through, and they want help. And in this point, I want to add that some of the actions being taken, such as the closure of airlines, these have a tremendous impact on communities, on the sense of isolation there, and I can't overestimate that impact. But I also want to emphasize the fact that in these discussions, what it also drives home is the idea that these are the people who have many of the ideas about how to implement things, how things can be done, and we have to listen to that. They mention that the fact that bodies are often not removed quickly enough is really upsetting to them, as is the sense that if they have someone who is ill and they don't have anywhere to go or they can't be moved quickly enough, this again is extremely upsetting to people. There are other major needs. Food. People are hungry in some of these communities and they don't know how they're going to get food, but they've also said it is not just things like food. Sometimes we can't cook the food if it comes because we've run out of other things. Automobiles don't have fuel, houses don't have charcoal to cook things. These are some of the gaps out there. And then finally, the whole impact of this on the economy is clear. For people on the outside, we may talk about things like GDP, but for people on the inside, it's where are they going to get money? Where are their jobs? And to drive this home to a very concrete level, some of the people who work for wealthier families are being released because wealthier families are worried about infection coming in, but that, which is understandable, very understandable, has the impact that people who work there are being released from jobs. And so these are some of the things which are being expressed very directly. It gives you a sense of how the impact of the outbreak is affecting things more broadly than just disease control. So at this point, let me turn the discussion over to David, who is really going to cover some of these other aspects. Thank you.
Sure. Good morning, everybody. I was appointed to be coordinator of the United Nations system's response to the current Ebola outbreak on the 12th of August. I travelled with Keiji Fukuda to the region on the 21st of August, returned and have been debriefing to WHO Director General on around the 29th of August, and we have just been in New York with the United Nations senior management yesterday and are here to work with groups in Washington, and we will continue that, and then I plan to go back again next week. By United Nations system, I mean organizations that include the World Health Organization, United Nations Children's Fund, or UNICEF, the World Food Programme, the Office for Coordination of Humanitarian Affairs, the World Bank, and about another 30 bodies that have some way of working with the countries concerned, particularly the peacekeeping operation in Liberia, which goes under the acronym UNMIL. Together with the partners that Dr. Chan has described, particularly the Médecins Sans Frontières group of organizations, the Red Cross movement in International Medical Corps, as well as some of the countries, again, that Dr. Chan described, who are coming in to support the affected countries in the region. We have come up with a plan to provide greatly increased assistance to the governments of Liberia, Sierra Leone and Guinea. And we will also strengthen the capacity of other countries in the region in case they are touched by this Ebola outbreak. There are 12 parts to this plan, and you might say, why is it so many pieces? And the answer is because this is complicated. And they include, firstly, efforts to strengthen communication and messaging, and indeed the mobilization of societies about the outbreak, and in particular to make sure that the information that people have is the correct information, especially as Dr. Fukuda described, true understanding of how you do and do not get infected. And secondly, care for people who have the infection. It's impossible to control this outbreak if people who are infected cannot access good care, and also if those who provide the care are not able to do it in a way that controls the extent to which infection is passed on to others. And this does include the handling of those who do not survive, and in particular the safe and dignified disposal of their bodies. Mainstay, thirdly, of this is diagnosis of those who've got Ebola virus disease, identifying them and properly confirming the diagnosis, and then tracing contacts so that the chains of transmission can be understood. Fourthly, other health services for other conditions in the affected countries are not working. That's partly because health workers are very busy trying to respond to Ebola, and also because there are many who just cannot come to their places of work, partly because, understandably, with their colleagues getting ill and in some cases dying, they don't really feel that they can be at their health services. So getting care for malaria, so that women, if they are trying to deliver children, can get help with delivery, and other common diseases is absolutely critical. As you've heard, point 5 is the need to make sure that food and nutrition are not in any way impaired, because if communities can't access food, then they will end up with nutritional challenges which will compound their difficulties. 6, transport is absolutely critical. Motorcycles and trucks, and so getting more motorcycles and trucks into where they are needed is an absolute priority. Number 7 is materials. Materials so that you can prevent yourself from being infected, but also materials that you need for dealing with the infections and for dealing with other challenges that occur. 8 is cash. Cash to pay salaries, cash to get the entitlements and incentives to people who are working on this to them, including the burial teams, and cash because this is not a cheap operation. 9, medical services for those who are responding, so that if they get sick, not just with Ebola but other conditions, they are not facing the prospect that they just can't get help. 10, air access and sea access. At the moment, boats are not docking in the ports in these African nations, and also, as you've heard, air access is impossible. And without air access of some dependable kind, it's very difficult indeed. Number 11, the economies of the affected countries were doing really well until this outbreak started. They're recovering from civil war and they had good growth rates. But now, with revenues down, economic activity reduced, a serious economic downturn is likely, and that needs to be dealt with, prevented, and if possible, with rapid recovery. And lastly, number 12, a need for strong and powerful coordination and leadership of all those who are providing help. Those of us who've worked in complex situations know that coordination saves lives and improves efficiency. So, ladies and gentlemen, thank you very much indeed for what you're doing to bring this issue to the world's attention. It needs a global response, and actually a really massive effort quite quickly. We are not in a position where we can afford to lose a day, because this outbreak is currently moving ahead of efforts to control it, and the people in the countries very much depend on international solidarity and support to get a proper response. Thank you.
Thank you, David. Here's the way this is going to work now. We're going to open up the floor for questions. We're going to take 3 questions from the room, and then we will go to answers. And then, as you know, we have a number of participants on the phone. We'll take 3 questions from the phone, answer those, then back to the room. So let's start with the room. Questions, please. 1, 2. Tell us your name and who you're with as well, please.
Tom Curry, I'm with Congressional Quarterly Roll Call. I wanted to ask about the question of transportation, especially international flights. If most air carriers are not flying to that region...
Excuse me, speakers were unable to hear the question.
Yes, I'm aware of that. We don't have a microphone for you. I'll reword the question for you when they're done asking it. Sorry about that.
Most air carriers are not flying to the region right now with the affected countries. That is a kind of cutting off of those countries from help that they need. How would you persuade air carriers to fly there? I mean, is international UN agencies have the ability to persuade them or tell them to fly there?
And that question, just for the people on the phone, was given the isolation that the area is experiencing because air carriers are stopping flights to those affected countries, how can the UN persuade them to resume their flights to the region? Second question back there.
Joshua Keating from Slate Magazine. Do you have a sense, in terms of a rough dollar figure or a number of health workers, of what still is needed? What does an adequate response to get ahead of this disease look like?
All right, that particular question came from Slate, and it was, do you have a rough dollar figure of what is needed to respond to this? One more question from the room? Yes, go ahead.
My question is about the intergovernmental coordination. How does that kind of work when you're dealing with a variety of nations and governments that have different capacities, different interests? How is that working in West Africa and in the Central African outbreak as well?
Okay, that question was about the intergovernmental coordination when you have different countries with different interests. How does it work? All right, let's take these 3 and then we'll go to questions from the phone.
I'd like to take the first question. Your point about commercial, this one. Your point about commercial airlines stopping to operate is very real. These 3 countries, they feel totally isolated. And the World Health Organization, in conjunction with ICAO, IACO is another agency, also with IATA, we bring together the operators, the associations of commercial airlines, and also operators of international airports to discuss and understand their concern. Why do they stop flying? In fact, the answer we're getting is interesting. We even talk to individual airlines to hear from them. What can we do to bring them, to convince them that they can operate again? Number 1, they are not actually afraid of Ebola. We were told that because they want to be sure that the countries they are flying to have good standard health care to take care of their crew members should they fall ill with non-Ebola medical issues. Should they need medical evacuation for cardiac or surgical emergencies. And this is clearly not happening on the ground at this point in time. So we are working with partners and see how we can bring them back and ensure the airline companies that, yes, these services are in place. And the other piece is, of course, we would work with them to advise, what are some preventive measures that the airlines could take, and as well as the countries on exit screening, very robust exit screening of individuals. Number 1, no sick person should travel. Number 2, contacts of Ebola patients should not be allowed to travel. But all other nationals from those countries who are healthy should not be discriminated when they travel. So, I mean, we have a very clear guidelines to lead along those lines. But you're right, we need to continue to work with the governments affected to show to the international community, including the commercial airlines, the measures they are taking will increase their confidence.
Okay, now I'm going to move these over. Thank you very much. I'd like to talk about cost, and I'd like to talk about coordination. And I want to stress that the current perception of the cost is that this is going to be an expensive struggle. And I think it's going to certainly cost at least $600 million, and it may be a lot more, to get the necessary support to the countries to get the situation under control. And in terms of the numbers of personnel, we get Dr. Fukuda to give precision, but the real challenge is to get the existing staff in the countries in a position where they can go back to work. And that is a combination of the material that they need to protect themselves and the money that is required for the necessary inducements, hazard pay, that they deserve. And so getting that in place is number one priority, and we hope that we will be able to at least create the conditions where this is possible within the next 4 weeks. In terms of coordination, the third question, this is clearly absolutely critical. And you heard about a number of countries that are coming together, and so a form of intergovernmental coordination is now being set up that uses the United Nations capacities, that also involves all the major non-governmental organizations that we've already mentioned and the different parts of the United Nations. This needs to be broad so that it engages everybody, but it also needs to be carefully directed so that it takes account of the World Health Organization's views of needs. Most importantly, it needs to be under the direction of the presidents of the affected countries, and it needs to be characterized by 100% accountability so that everybody knows what money is coming in and what it's being spent on. This is my job, is to make sure that this happens together with the colleagues, and during the last few days we're setting up within the system all the different pieces that are necessary to make that happen. It's not done overnight, but it will be done as quickly as we can make it. I want to add that I'm really very impressed that a number of regional bodies are already engaged. ECOWAS, which is the Economic Commission for West Africa, is involved, and also the African Union, which covers the whole of Africa and based in Addis Ababa. Both of these organizations are taking a role, and there are some very tricky issues around access and landing of aeroplanes and so on, and border controls that are being dealt with. There's one specific group called the Mano River Union, or MRU, which is the union of the countries in West Africa that are particularly affected, together with Côte d'Ivoire, and they are playing a major role as well. Obviously, those kinds of political coordinations are key. Dr. Fukuda, did you want to say anything about numbers of personnel? I don't know whether we have...
Before you start, this microphone needs to go between you two. The one in front of you is not working.
This one's not working.
And Jason's getting more exercise than he knows what to do with today.
All right, we will move mics.
Wait, so this one's not working here.
The one right in front of you is not working. Set that aside.
Okay, mics have moved.
Okay, thank you, David. Just everybody, to give you an idea about the numbers, and of course there's no static number because as the outbreak gets bigger, you need more people to work on it. But in talking with one of the organizations about how many people it takes to take care of about 80 patients, the estimate that we got back was about 200 to 250 people are needed to take care of that many patients. And so in addition to the frontline workers, you need people supporting those people also. So it gives you an estimate about how many it takes to care of just a relatively small number of patients. And so as the outbreak gets bigger, we would estimate that there's going to be the need for several thousands of people taking care of patients among the many different countries. In addition to that, there is a need for several hundreds of international workers to provide support. These are people who are going to be providing expert knowledge, training health workers in various aspects, running some of the laboratories and so on. And so it's a quite large operation. It's not a static number, and it will depend on the size of the outbreak eventually.
Okay, at this point, let's go ahead and take 3 questions from the phone. Austin, are you still with me?
Thank you. At this time, we will open the floor for questions. If you would like to ask a question, please press the star key followed by the 1 key on your touchtone phone now. Questions will be taken in the order in which they are received. If at any time you would like to remove yourself from the questioning queue, you may press star 2. Again, ladies and gentlemen, if you would like to ask a question, please press star 1 now. Our first question comes from Miriam Falco with CNN Medical News.
Hi, this is Miriam. Thanks for taking the questions. Some of the responses were a little hard to understand. I don't think I'll replicate anything, though. I have a question about who exactly you're addressing in this press conference, because a lot of what you addressed was addressed in your last press conference about the situation in Ebola, the need for resources, etc. So it makes one wonder, well, why hasn't this been put in place already? So can you give some specific numbers? How many healthcare workers are needed? How many trucks are needed? How much money are you asking for from whom? And also, you addressed the stigmatization, and you talked about the airlines, for instance, so some of the stigmatization is on the outside. But when you spoke to these leaders, a lot of stigmatization is happening within their own countries. How's that being addressed? Especially when you look at the quarantine zones, and as you address, some people aren't getting food, but they can't get out to get the food either. They can't go to work, etc. So I'm just curious what's happened in the past few weeks, because obviously this has been getting worse, but this has been bad for a long time.
Austin, let's take 2 more questions as well. Thanks, Mary. Austin, are you still with me?
Excuse me, speakers were unable to hear you.
Austin, are you hearing me
Okay,
okay
can
now?
you hear me now?
Yes, ma'am, I sure can.
Okay, should I repeat the question?
No, no, we heard Miriam just fine.
Okay.
We heard Miriam just fine. Austin, we're just looking for 2 more questions. We'll take 2 more questions, and then we'll answer. Austin? I think we're killing microphones by the by the answer. Austin, can you hear me?
Barely, yes, ma'am. It keeps going in and out.
Okay. We're looking for 2 more questions from the phone, just so we can get as many questions as possible. We'd like to take 2 more questions, and then we'll answer them all at once.
Okay, our next question comes from Lori Garrett with the Council on Foreign Relations.
Thank you very much. As has been previously stated, we on the phone heard perhaps 35 or 40% of your collective comments. So my question may actually, have been covered, but we couldn't hear it on the phone. My question is the following. If this is such an urgent response, if the window of opportunity, as CDC Director Frieden said yesterday in a press conference, is closing for control and stopping this epidemic, why are we having committee meetings and sitting down and trying to hear the woes of the commercial airlines industry and so on? Why aren't we in a command and control structure with dedicated military assured transport routes, with dedicated sea lanes, and with a massive mobilization such as would be happening for a major humanitarian response, such as the way the U.S. Navy and Singapore Navy coordinated response to Aceh after this tsunami in Indonesia? It sounds like we're still at, can we all just get together and have meetings and try to coordinate where the money's going to go?
Okay, awesome.
Thank you. Our next question comes from Betsy McKay with Wall Street Journal.
Hi, thanks very much. My question is actually very similar to Lori Garrett's. Don't you feel you're at the point where you need military services or peacekeeping forces from donor nations or the UN or whoever to do peacetime work, like, you know, building field hospitals that are needed to function as treatment centers, you know, and getting more people in? I mean, so far the talk has been about volunteers, but the volunteers aren't coming. So aren't we at the point where we need bigger forces to take command of this now?
Okay, thank you, Austin. I'm hoping this helps a little bit. We were told to keep the microphones closer, so I'm switching us to handheld microphones. I apologize that you had a hard time hearing us earlier. The UN Foundation will have an audio file up of this as soon as the press conference is over. So let's start with Dr. Chan, please.
Thank you. I'd like to thank Mariam, Laurie, and Betty for your questions. I will respond to some of them. The first one about stigmatization within the country. This is indeed one of the pieces that we really need to tackle, and we've been tackling that. There is a lot of misunderstanding, a lot of rumor, a lot of denial within communities that Ebola is not real. This is something being given to them from outside. So, you know, UNICEF and other NGO on the ground are working really very hard trying to get the correct information out and encourage people to come forward for treatment, because it is clear to us that the early treatment give infected persons a better prospect for survival. We need to also talk about 50% of the people who survive the diseases. And so it is important not to send the wrong message saying that you're going to die getting Ebola. If you come forward, things can be done. And also, communities have understanding that they are being punished for getting the disease. So all these are factors making stigmatization, making the outbreak control very difficult. We will continue to work, but outside is also another important piece we need to tackle. The fear factor about Ebola has stimulated uncoordinated measures that are out of proportion of the risk of getting infection. As you have heard from Dr. Keiji Fukuda, the people that are at high risk of getting the diseases are the people who are working to take care of patients, who are taking care of sick family members at home, and they are in direct contact with body fluids of the infected persons. So, I mean, for people like you, business travelers, others, I travel to the region and my colleagues travel to the region to support the efforts of the country. And they all come back healthy. And the high-risk area is different from others. Most people are, not at high risk, and if anything at all, the risk is very low. So we need to get that out. Now, Laurie, thank you for your question. Yes, we do need a major response. And in fact, WHO, we have experts working with, countries who have provided very strong foreign medical team to the typhoon response, Typhoon Yolanda in Philippines, as well as in, Haiti, where there was an earthquake. But it is a different magnitude of anxiety and fear. And I don't mind to tell you, very far and few in between were we able to mobilize foreign medical teams. That is a reality. Without the support of foreign medical teams, it is very difficult to mount a response to the scale that is in keeping with the gaps that David and KG have just highlighted. I think Betty asked similar questions, and let me perhaps at this point pass to David. He would like to also comment on the response.
Thank you very much indeed. Well, this is probably the most important issue that we now need to address, is making sure that the response is appropriate to the nature of the problem, and making sure that all concerned are able to advance as intensively as necessary. I have sought so far not to use language or style which encourages people to perceive that this is something that we cannot deal with. I want to be very clear to you, this is doable with the institutions and resources that we have, but the scale up that is needed to actually achieve it in the time that is available before it really does get to a very hard to control situation. The scale up is needed of the order of 3 to 4 times what is currently in place. And that is why over this period, next few days, we are changing the way the whole of the United Nations works on this issue. We are talking to key governments to get them fully engaged. It is up to them to decide what they're going to put in. And we are talking to all other groups who can provide support. But I do want to stress 2 things. Firstly, the governments of the affected countries are in charge and will stay in charge. And our role is to help them to do the job they need to do. And number 2, we will pay full attention to the issue of infection control and trying to do what we can to ensure the safety of all personnel who volunteer or agree to work on this issue. And that is not trivial, because you are aware that there have been a number of infections among care personnel and responders, and therefore that has to be taken extremely seriously. So number 1, governments are in charge, and number 2, the care and well-being of responders is taken on board. But the points that were in those questions on the telephone about the need for something absolutely extraordinary and unusual, well taken, and that is what we are putting in place.
Okay, thank you all. Let's go back to the room for another 3 questions here. 1, 2, 3, 4.
Jason Bowman with NPR. I would like to know, at what point would it switch over to being something beyond the local governments being in control, and it does go to some coordinated international response, like a peacekeeping mission that is coordinated throughout the region by the WHO or the UN or whoever? At what point would a switch over that occur, or is that completely off the table?
All right, that's Jason from NPR asking at what point a switch to something other than the government's being in charge would happen.
Hi, Lisa Stark with Al Jazeera America. Can you, 2 questions. One is, what more at this point are you asking of the U.S. government? What more do you need from the U.S.? And secondly, you mentioned that it could take at least a month to get in place the protective measures, for example, and some of the other things you want to see in place. Do you have any sense of a time frame on when you may be able to bring this under control if you can follow your 12-step program? Do you have any sense on that?
All right, that's Al Jazeera asking what more do you need from the U.S. government, and do you have a sense of the time frame for when we could bring this under control? What was my other question?
Jennifer, actually, similar question. I just want to know, do you have any assessment of how long it might take to contain the outbreak? Whether it's very significant, or you might have more resources later on and you might be quicker to contain your outbreak, or you might out of control mechanisms.
Okay, that was another question of time frame on that. So since that's so similar to the previous one, I'm going to add one more question in here.
Nellie Griswold with CSIS. What are you doing in Washington? Who are you meeting with, and what are you looking there?
Okay, Nellie from CSIS wants to know what we're doing here. I'm going to put another journalist in.
Thanks so much for being here with the Voice of America. You know, there's a lot of emphasis on West Africa and those 4 countries in particular where the Ebola virus is very prevalent. But then obviously it's just a question of one person going to a non-affected country and what
Okay, that's Voice of America asking what kind of precautions are being put in place to keep Ebola from traveling to another country. Let's go ahead and answer this.
Thank you, Debbie. Your question, number one, we are here to meet with the U.S. government and many departments, okay? And of course to meet with the World Bank. Jim Kim and his team to discuss, and of course by teleconference, connect with our partners who could not travel but would like to, share their experience. Okay. Now, I think the question from Voice of America and others, I can refer, well, let me give you my view, and also that is all included in the roadmap that was launched by the World Health Organization last Thursday. First, in the roadmap, we articulated very clearly that countries with very intense transmission, and of course the three countries, Guinea, Sierra Leone, and Liberia, we would like to reverse the trend in 3 months. And of course, we will do our utmost with this international response, coordinated response. When money is coming, technical expertise is coming, we hope to stop the transmission in 6 to 9 months. The second thing is another group of countries that are having localized transmission. And like in the case of DRC, in the case of Senegal, we would like to stop all transmission within 8 weeks of an index case first arriving their country. The third group of countries who share land border with Ebola affected countries and or countries that have major international transportation hub, we would like to support them. We are already working with them to strengthen their vigilance, surveillance, and ask them to set up response plan under the oversight of the president of countries, so that, in the unfortunate event that you do have a case arriving at your doorstep, you are ready to pounce on it and, the smother the fire. So those are the big groups of countries, not just in Africa. The last group of countries also apply to the countries in other regions of the World Health Organization. Jason, you asked a very interesting question. I don't think any government in this world would accept a takeover by others. So we want to make this point very clear. Whatever we are doing, we are supporting national authorities to take the leadership. And of course, the national leaders, we would encourage them to work with district leaders, including religious leaders, community leaders, chiefs. They know their context much better. It is very difficult for outside partners, including the UN and others, who are prepared to help and to take over. This is not the kind of system we work in no country, I'm sure. Would your country like to be taken over?
Thanks very much indeed. Just to that succession of questions and to supplement what Dr. Chan has said, the style of our work at the moment is beyond trying to simply have meetings and discuss. We are seeking to ensure that all governments, professional groups with an interest and an involvement not just in public health but in the security of our world own this issue as their problem. We're seeking to ensure that they agree to act together on this problem. We're seeking to ensure that they commit to working to end the problem. This is really vital, and it has to be done, as we have said, in a coordinated way. Otherwise, there is great danger, there is also inefficiency. So coordination is needed, which is our role. We found in our travels that the national leaders, the presidents, the ministers, the traditional leaders in all the countries that we went to were fully committed to act. We found that normal political divisions were being set aside so that there was collective energy behind this issue. And in our organizations, we found that the normal tendency for different organizations sometimes to work along their own paths was just not being shown, and that we have full joined up action. I can't stress to you how important it is to maintain this, and that is the style with which we are doing our meetings today and tomorrow and on into the beginning of next week, as we try to build a global coalition of response support for this issue. I hope that's clear. It's action by all.
Thanks, David. And can I just augment a couple of the points made? One of them is that, disease outbreaks fundamentally require the cooperation of people. It's simply not an issue where you can impose something from the outside. People have to understand, they have to cooperate, because disease transmission takes place in houses, it takes place in buildings, it takes place where people get together, and these things really fundamentally require the communities to understand what's being done and to help out and to cooperate and provide their thoughts on how to do this best. Now, one of the questions that came up was what's being done to help other countries be prepared, because you're right, right now there's a tremendous amount of effort trying to control what's going on in the affected countries. At the same time, it is very clear in this world in which people can get on airplanes or can move from any point to any other point in the world that other countries have to be prepared for this. And so one of the things that we are doing is working with all countries to make sure that they have the information that they need, the guidelines. We are prompting them to look at things such as their own surveillance systems. What is it that they can do in case the situation appears on their doorstep? And in this situation, some of the best help coming out right now are from the African countries. We have Ugandan health workers who are there, who have taken lessons that they've used from the past. We have countries in South Africa who are right now discussing the issues and discussing on how they will provide assistance and what it is that they can do to contribute. So a lot of that activity is taking place among the countries not affected, but how they can both support and then prepare themselves.
All right, we're just a little bit late getting started, so I want to be fair to the people on the phone. I'll take 2 more questions from the phone, and then we'll need to wrap it up. So, Austin, 2 questions.
Thank you. Our next question comes from Kathy Solinka with Intro Health.
Yes, you've outlined how Ebola care will be provided, but what are the plans to provide general primary care to prevent indirect deaths from Ebola, to prevent people from dying of malaria, diarrhea, and other usually prevented diseases?
The second question?
Thank you. Our next question comes from Mark Goldberg with UN Dispatch.
You mentioned how the cancellation of commercial air flights have undermined the fight against Ebola. Can you just provide some more specific examples or details and how, as specific as possible, you can get into how these cancellations are hurting the international efforts?
Thank you. I'd like to take the one about cancellation. How does it hurt international efforts? And I'm sure David and KG would reinforce that. They personally experience the inability to travel to these 3 countries to meet with people. Their flights were canceled. And this is really a big problem. I have been in discussion with MSF, with other agencies, and the experts that are mobilized by WHO under a mechanism, we call it GOIN, is a Global Outbreak Alert Mechanism, where experts from around the world and many institutions are doing pro bono work for WHO to provide infection control, to provide clinical care, and so on and so forth. We are not able we are not able to deploy them because there is no airline going to them. And of course, the imposition by countries in West Africa not allowing UN plane or MSF plane to use the airport and the airspace is really not helping the response to the scale that we need. So those are really very specific examples to illustrate the point. Now, on the first question, I think this is extremely important. While we focus our attention on, bringing the Ebola outbreak in these countries under control, we must not forget the important role of primary healthcare system to make sure children get their vaccination, to make sure women get access to facilities to deliver babies, and also care for malaria, HIV, and TB, and for non-communicable diseases are also addressed. So what we are working is, under the UN mechanism is, while we mobilize coordinated response to deal with the Ebola outbreak, but we also activate mechanisms whereby health cluster partners, local NGO, some of the medical teams that are deployed by Cuba, some of the medical teams deployed by China and others who are there to provide a very much needed basic health care for other non-Ebola conditions. So we are moving in two pieces. But as I said, we do need countries to send their experts to help, but if the transport is not there, and if the fear factor is playing out way out of proportion, and it is very difficult to recruit people to come to support this surge that we very much need to bring the outbreak under control.
So thank you very much indeed for the question about air transport, and because it's so important, David Nabarro here, I'm going to supplement a bit what Dr. Chan has just said. We do understand the anxiety of airlines, and particularly the unions representing aircrew, about the possibility that they might face additional risk as a result of flying to countries where the outbreak is most intense. We believe that it is possible to reduce the risk greatly by the application of proper public health measures based on an understanding of the way in which this disease is transmitted, and by the measures that Dr. Chan just identified for in screening people before they get on planes. At the same time, we know that it is not possible for us in the United Nations system to go further than simply providing advice. We also understand that there are certain countries in Africa that have reduced the extent to which planes may fly through their airports to move on to the countries that are affected by the outbreak. This has had operational implications for ourselves in the United Nations, and also for our colleagues in Médecins Sans Frontières, who have not been able to move their staff dependably between the different locations or to move equipment. Again, we're working intensively with these governments to encourage them to permit the movement of people and planes, and at the same time to deal with anxieties about the possibility of infection. We're particularly grateful to the President of Ghana, who has agreed during the last few days for the establishment of an air bridge through Accra and into the nations where we are working on the outbreak. And this will be an air bridge that will build up to whatever size is necessary to move both the people who are providing assistance and also goods, so that they can come in a more reliable way. This will be accompanied by extreme care to make sure that all passengers are properly screened, and of course that air crews are properly protected. KG Fukuda and I recognised when we were travelling that there is anxiety for pilots, and so it requires complying with basic precautions that are put in place by the companies that supply the aeroplanes so that pilots and aircrew are not put in any danger at all. And we will treat this with utmost responsibility. We want the planes to come in, but at the same time, we want to be sure that aircrew are properly protected from risks to their own health. I hope that's clear.
That's all we have time for today. I want to thank you for coming again, and I want to thank you for your interest in this story. If you have any additional questions going forward, you can call my office in Geneva, or you can call the Pan American Health Organization Media Office here in Washington. Thanks so much.